Good morning, everyone. Welcome all of you joining the public presentation organized by the Occupational Health Center. Today's the topic is about women's work and the COVID-19, the priorities for supporting women and the community. We are so pleased to have Katherine Scott, the senior researcher from the Canadian Center for Policy Alternatives, a national office in Ottawa, is going to present to us. We would like to acknowledge that we are on the Treaty 1 territories, the traditional territory of the Anishinaabe, Greek, OG Greek, Dakotas, and Diné peoples, and the homelands of Métis Nation. We respect the treaties that we were made on these territories, and we acknowledge that we are all treaty people. At the Occupational Health Center, we commit ourselves to our process of reconciliation with Indigenous communities. So for the audience participation and the follow-up. So to ask the question, please put your question in the chat box section on the right side of your screen. And the presenter will try to answer the question after that. And we may not be able to answer all the questions in the Q&A, so please connect with us afterwards to follow up. This event is being recorded for viewing later and share on the social media. And also please, participate the follow-up evaluation survey, giving us some feedback for the upcoming event. The Occupational Health Center is the community health center funded by the Winnipeg Regional Health Authorities. We are now currently located on 167 Sherbrooke Street, Winnipeg, Manitoba. We provide the services to the Manitoba workers with work-related health issues and work closely with the Joint Workplace Health and Safety Committees for trainings. So please also visit our website for more information and resources. Now, this is the turn for me to welcome Katherine Scott. Thank you so much. I'm going to stop my screen, then you could put up your slide.
Right, thanks, Tiffany. And thanks to everyone for coming this morning. I'm really excited. I was very pleased to receive the invitation from the OHC in Winnipeg. I'm going to try to pull my slides up right now. Hopefully this will work well. Okay. Okie doke. Let's see. Hang on. Oh, life is good this morning. There's always that moment at the beginning of a presentation when you think it's all going sideways. So this is really, this is terrific. So as I said, I'm Katherine Scott. I'm a senior researcher at the Canadian Center for Policy Alternatives. I'm in the national office in Ottawa, but I'd like to take this moment to give a shout out to the Manitoba office of the CCPA, headed up by the wonderful Molly McCracken. I hope you've had a chance to or perhaps follow the work that they do at the CCPA Manitoba. I can highly recommend a report they just put out last week called Rising Together or Falling Apart, that looks actually at the pandemic experience in Manitoba this past year and sets out some recommendations certainly for moving forward. My job today is I will be picking up some of that wonderful research and insight and talking about women working COVID. I'm going to be speaking about a report actually that I wrote last winter that looked at certainly the initial impact of the pandemic and how that was playing out for women across the country and what the type of response or policy response was at that point from different levels of government. I'm going to take this opportunity to sort of, fast forward to where we are right now. So I'm going to sort of set the context. I'm going to talk a bit about our current moment this fall, and then speak a bit more about what the policy response has been with a particular focus on women and marginalized women in particular, and the whole issue of care. I understand that this is a diverse group. There are lots of community folks, lots of folks from the health sector, the labor movement, and a shout out certainly to the Federation of Labor sponsoring this work, or sponsoring this session. So hopefully we can get into a bit more of a discussion. I'll leave some time at the end for your questions. I'd like to stress at the onset, of course, that I work in the national office. I tend to look at the national trends, but as we all know, the rubber hits the road in communities. So hopefully I've got a bit of information on Manitoba, but getting into the details around the specifics of how you've lived the pandemic in Winnipeg and Manitoba more generally, and what that looks like. I know many of you are community workers, so you are the experts, not me. So I just wanted to put that up front as context. It struck me in looking back over this time, like where we are in this current moment, that, obviously the imperative to build back better has never been more urgent. Yet in an odd way, it's been elbowed out of the headlines, whether it's the focus on cost of living, rising inflation, obviously the issues around affordable housing, which are acute, concerns about disrupted supply chains and the like. Yeah, it's important to remember, certainly from my perspective, that the people that bore the brunt of this pandemic were marginalized communities who saw us through this crisis and continue to experience its most damaging impacts by way of elevated levels of violence, increased isolation and ill health of the type certainly I know you must deal with in your work, increased economic insecurity, and actually, reduced access to vital community supports. So really, I'd like to come back to that theme about who paid the price. It's really important to stress that and to continue to remind in this moment when it seems like, in some ways, an elusive and inclusive recovery seems to be elusive. Like we have to hang on to that vision and redouble our efforts to ensure that it's a reality. So let's see. I'm hoping. Excellent. As I said, I think we're at a key moment, really. We have the sort of post-pandemic economy, post-pandemic society is coming into view. And, I think, as I said, it's really important to acknowledge who paid the price or who has paid the price thus far. Some people have talked about the pandemic as the great revealer. From my perspective, I'm not particularly sure. I think the reality of patriarchy and racism and colonialism, the reality of ableism, certainly has always been readily evident. But what we saw with the pandemic, it revealed the ways in which inequality is, in graphic ways, is baked into our systems, is baked into our economy, is baked into our institutions. So from the very high rates of death among vulnerable seniors in our long-term care facilities to the high levels of illness and death in highly racialized communities and neighborhoods, to the exorbitant, huge increase in stress on families and in particular on women as schools shut down, childcare shut down and the like, many of whom were forced to step back from their paid employment and indeed stepping out of the labor market altogether to make life happen. So as I said, I think, the pandemic was highly unequal. And I think the recovery actually is proving to be as unequal. Jim Stanford, this is a quote, I should have put it on the slide. This is a quote from Jim Stanford, who's a noted Canadian economist. You might have seen in the papers and the like, a good friend to the labor movement. He said, obviously, the recovery is proving to be as unequal. It's a brutally unfair concentration of the recession on the backs of those who can least afford it. Sitting from my perspective, looking back, and we've talked, certainly this has been a theme, looking at the economy, we know that some groups of workers, some communities recouped employment or economic losses quite quickly. In fact, many of those of us working at home, and I include myself in that as a knowledge worker, we didn't miss a beat, we didn't miss a paycheck. Yet at the same time, those workers in low wage or front-facing occupations in like food and accommodation, retail and the like, they've been on an economic roller coaster since last winter. And the first chart I'm just going to put up, there we go, sort of describes this in some detail. You can see, I hope you can see, I'm just wondering my slide, this is, there we go. This is a chart of looking at the loss of employment and the loss of people working more than 50% of their hours cumulatively. It's looking at women and women and men certainly, and it's looking at their employment losses since February 2020 by income or earning group. It's quite graphic. So the red line at the bottom, I'm not sure if you can see my pointer, is highlighting the situation of low-wage female workers who are earning less than $17. They're in the bottom 25% of the earnings ladder, who have obviously completely hammered in April in the recession, the precipitous fall of employment in the spring, had something of a recovery last summer. Of course, everything went sideways with the second wave. We saw around Christmas and then a precipitous fall with the third wave. back and forth. So really difficult. You see at this juncture, I ran this information certainly in the summer. By July, they were still working 10%, they still had 10% fewer hours and jobs and fewer hours than pre-pandemic. See, men are certainly in that lower earning bracket, similar, it has the same picture. You've got the recovery, they're still earning still fewer jobs and fewer hours than pre-pandemic. And as I said, the folks in the top earning, those are $35 an hour or more, women and men, basically had recouped their losses by last summer, July 2020, and they've been sliding along, but have been sort of proceeding, haven't experienced, as I said, didn't skip a beat. This picture always just sums it up really clearly about, how unequal this recession has been, but even within that particular groups have been really disproportionately impacted. And the next chart always just sort of catches my breath. This is a chart that looks at, and this is for Canada, looks at the status of mothers in the labor force, and you can see what happened to them. The bottom line is single mothers with kids under 6, who, and this is they're looking their actual hours worked, just completely were hammered by the recession. You see a precipitous drop, like this is close to almost 60% loss of employed hours. You see the recovery somewhat through last fall, and then the continuing slide. Again, we've had a bit of a recovery up into in the summertime, but as of midsummer, lone parents with little kids were still working 46% fewer hours than they were before February. That is an extraordinary loss of income for a group that may or may not have had external support, were isolated, really struggling. In fact, the situation of lone parents, I don't think has received anywhere near the attention it has that it demands. We see with this orange line here, that's single moms with kids 6 to 12. Certainly they haven't had the same types of losses, but still considerable. And even mothers in couple families. Certainly you can see with the ebb and flow of the pandemic that they remain significantly, again, below pre-pandemic levels. So not everyone's coming back in the same rate, and not everyone, and certainly mothers, those with caring, responsible single moms in particular, are bearing the stress, are bearing a huge cost. Other groups, other marginalized communities are similarly being impacted. This chart looks at the prevalence of economic insecurity as reported by families over the course. We have new data from the labor force that allows us to break some of this out by racialized communities. This chart looks at both Indigenous, they're the blue bars, and racialized communities, they're the gray bars, as compared to white individuals, white households. And the difference in the number of people reporting economic difficulty getting to the end of the month, it's by a factor of 2. So on average, over this entire period from July 2020 to June 2021, 28% of Indigenous families and 31% of racialized families were reporting reporting difficult levels of financial insecurity, as compared to 16% of white families. So we know when we look who paid the price, these families paid the price and continue to do so. So I think it's really no exaggeration to say that this last 18 months, I guess 20 months now, has represented a huge threat to Canada, our inclusive society, to the well-being of marginalized communities. It's been a huge threat to gender equality, for sure. And certainly those folks who got caught on the wrong side of the pandemic are continuing to struggle. I want to sort of talk about our current moment, like where we are in the recovery. So I think that sets the context of who paid the price, but looking nationally, like where are we now, looking particularly at the economic situation in terms of economic security and the like. We have in the aggregate, and I think that's really important to say, in the aggregate, the StatsCan reported by September, I guess 2 months ago now, that we had finally recouped all of the employment losses from the pandemic, the fall in employment in spring 2020. We'd finally caught up, and that was true among women and men. And we're almost there with young people. And I think many of you will recall that young people in particular were really hugely impacted by job losses then. We see a slow recovery of employment among moms with kids as well. That was evident in the data. And we see some really important narrowing of the employment gaps that had opened up between, for instance, Indigenous workers and non-Indigenous workers, both men and women, racialized. Newcomers, recent immigrants have actually had quite a pronounced recovery in employment levels. So we've seen in the aggregate, things are, the employment picture has stabilized or has come back at this juncture. I think all bets are off right now in terms of the cases. We can talk about that, but for this snapshot in early fall that we had recouped these employment losses. At the same time, it's also true that job creation actually hasn't really kept pace with population growth. So the employment rate hasn't been coming back, and average hours are still trending. Actual hours worked are still trending below pre-pandemic levels. The suggestion is people are in jobs, but they're still not working the same number of hours. And we know that there's from the October jobs report that 117,000 people are continuing to work less than half their usual hours. And in total, 230,000 people have left the job market altogether. And 2/3 of those people are women. That's certainly a significant concern. There was some talk earlier on in the summer and so forth about what some commentators in the States were calling the mass resignation, whether people were sitting on the sidelines, they were deciding they weren't jumping back, they were going to change their jobs, there's going to be a lot of churn. There's no evidence of that in Canada at this point. There has certainly not been mass resignation, although some people increasing numbers of older women are leaving the labor force. As I said, we've got the 230,000. But there is a notable concern around the number of long-term unemployed. There increased insecurity in the sense. So what we're seeing, I think, is continuing economic insecurity. I think this situation is being compounded, obviously, by the increases in COVID cases that have been reported recently. I know you folks are tracking that very closely in Manitoba, and that new restrictions are pending. Obviously, there are other issues related to cost of living and disrupted supply chains. You know how the economy is proceeding right now. Situation of affordable housing remains acute, lack of affordable housing, and that was a huge issue in the past, the recent federal election. There seems to be as well a disconnect between job vacancies in certain selected industries like food and accommodation, healthcare, like runaway job, very high job vacancy numbers in healthcare. But again, only modest wage rates, even with the prevalence, continuing prevalence of caps on wages, like we have in Ontario and Manitoba. There's a cap on public sector workers. So all of which I think together really speaks to a continuing climate of economic uncertainty, despite our employment gains, which are not unimportant, but generally the context is it's been challenging. In Manitoba, and I know I'm speaking to folks who are, you have certainly more knowledge than I do on the ground. I pulled some of the information, like what's going on there this fall with workers in Manitoba. I think, again, as I said, there's been a recovery in employment levels. But the experiences I looked at the data seemed to suggest, 1 month there was an uptick in jobs, and the next month it was clawed back again. I certainly know really difficult summer with the droughts and the like. Service sector employment, it would seem that women have done a bit better. Their recovery is a bit more advanced as the service employment picked up, and that there's a significant number of older men in Manitoba leaving the labor market. But on the whole, all in, Manitoba's sort of 93% of where you were February, so still a ways to go in the employment situation. I have two charts here just looking at the trajectory of employment rates among men and women. Women are now almost half a point less for their employment rate than they were before the pandemic. Men haven't quite got there. And we've seen as well a narrowing of the employment gap between men and women, so the gender employment gap. What's interesting about this chart, as it shows, and it shows in other provinces what happened with the pandemic. is with every successive wave, you see women basically leaving the labor force. I'm going to come back to the whole issue of care, leaving the labor force, opening up the gender wage gap, or just gender employment gap. Then of course, recovery. Then of course, second wave hits, women leave the labor market again, they come. So when we talk about the course of the pandemic and women, I would make the argument that women are the real economic shock absorbers in the economy, because they have been on this roller coaster in and out. And that speaks, and we can talk about this in the Q&A, into the profound gender bias in the labor market and the fundamental expectations that women remain the primary care responsible for unpaid and caregiving labor in the home. The other thing I'd note about this, the top line is Canada and the bottom line is Manitoba. And Manitoba continues to have one of the larger gender employment gaps in the country as compared to other countries. Alberta has the largest, but Canada currently is at 88%. So that means 12% gap, parity with men. Manitoba is sitting at 87%. This next chart I was trying to get a handle on what was happening in terms of the recovery of workers in men and women who were located in different industrial sectors. This is for Manitoba. It looks like spaghetti, I know. If you focus on the red line, what we're seeing here, these are women who are employed in vulnerable sectors, what I call vulnerable sectors. That includes hospitality, so that's accommodation, food, information, culture, and recreational services, as well as personal services, those things like hair salons and estheticians and small business people, a lot of whom are women, small business, heading up like 1 or 2 person businesses and the like, that sector, which of course has been subject to the public health directives and lockdown measures. You can see in terms of their recovery, and I mean, if this isn't the definition of an economic roller coaster, I don't know what is. So the red line are women working in these vulnerable sectors. And you can see again that their recovery in Manitoba remains, quite a ways from, still quite a ways from where it was pre-pandemic. Men have actually, in the same group, men in vulnerable industries, that's the teal bar, have done somewhat better, but not great. And of course, those in the rest of the economy, in the rest of all of the other industrial sectors, have actually, again, like last summer, 2020, the rest of the economy had this is men is the teal, the dark blue bar, women is the gray bar, but of course they've recovered all of their employment. And in fact, men in the rest of the economy have experienced growth. This is the Manitoba picture. Just a whipsaw, the experience of what that is for marginalized workers in those sectors has been really, really challenging. This just quickly I wanted to give you a sense of the level and number of people in Manitoba who are still working less than half their usual hours. That's still 30,000 workers in Manitoba as of October, this past October, obviously from a peak when there were 78,000 workers in this situation. It's interesting to track this. Again, goes to the fact that jobs may be coming back, but the people in those jobs are not necessarily working full hours. So all of which to say, I would think that there's continue to be significant challenges and a sizable gap between where we are and where actually we would hope to be at this point. I want to segue now to look at, so what has been the response? How have governments in Canada responded to this unfolding economic picture, this unfolding, these unfolding labor market dynamics? And I was talking earlier about how, COVID has been framed as the great revealer. I don't subscribe to that view 100%, but what I would say is COVID has revealed the extraordinary shortcomings in our social safety net. Those were graphically on display. Shortcomings in our income security programs, critically, shortcomings in our community services, the fragility and of private sector community services that crumbled under the pressure and lost massive capacity, and the exploitative nature, for instance, of our migrant work schemes, which effectively locked migrant care workers in the homes of their employers through this pandemic. The federal government, for its part, it's going here, respond to it. The federal government, for its part, really concentrated on mobilizing financial resources to stabilize the markets and to stabilize household incomes. They did this through a series of direct measures targeting individuals and businesses. They did this through transfers to provinces and territories for, healthcare, PPE, supports to schools and shelters, like for instance, shelters women's fleeing violence, food banks and the like. The federal government, our own research shows, effectively underwrote 86% to date, 86% of the costs related to the pandemic through these programs. The other thing that's been interesting about the federal response in Canada generally is that, as compared to other peer countries, Canada's response was significant. It was certainly on the larger scale, like last year, it was 14.6% of GDP. The other piece that was interesting and distinctive is the amount of resources that Canada spent targeting individual transfers to people in households. That was quite distinctive. A lot of countries targeted most of their money to businesses. In Canada, there was a significant share of money that was targeted directly to households with the CERB, and we were all familiar with the CERB, then the subsequent suite of emergency benefits, the CRB, the caregiving benefit, the sickness benefit, and the like, obviously the CEWS, all of the business, there were many programs. I would argue, and the data that we have now illustrate that, that intervention on the part of the federal government in terms of those emergency benefits and the additional one-off payments that went to seniors and people with disabilities was critically important in offsetting what would have been a horrific rise in poverty. StatsCan argues or has released sort of experimental research that says that the poverty rate based on market incomes last spring would have reached 40% if the federal government had not responded with substantial income support to the upwards of 5 million households that experienced loss of income and loss of hours, like 40%. As it was, and this impact was most profound, obviously, in marginalized communities. This chart here actually is interesting. It looks at the impact on the poverty rate of government transfers through those periods on racialized people. And we see even on this group of bars, basically in last spring, 2020, that effectively government transfers halved the poverty rate for racialized peoples by half. We see as it goes, so it sort of reduced that, the difference reduced, but it remained really important through March of this year, that these data show. For single moms, so another study found that had governments not moved, 56% of single mothers would not have had the resources to make ends meet, even for one complete month of joblessness. So, it's incontrovertible. The emergency benefit programs were incredibly important to offsetting massive economic losses. I say that, and at the same time, we know, and I know that folks in this group will have experience that a lot of folks continue to fall through the cracks. Many of the vulnerable groups, so including groups like the undocumented or irregular workers, and by some estimates, upwards of 1.8 million Canadians fall into this group, and other workers in the irregular that were not eligible for any of these emergency benefits, yet fully bore the impact of the closures and the economic consequences that flowed for that, such as sex workers and the like. We know as well that social assistance recipients really were left off the table, like really yawning silence on supports needed for the poorest of the poor in Canada. And that obviously includes people with disabilities, a large component of the caseload of social assistance, people with disabilities, youth aging out of care, single parents. These families actually had very few resources, yet faced a rollback of community resources and support, as agencies were coping with massive spikes in demand, and they, obviously fundraising, eroded, and a massive loss of support. So the poorest of the poor really didn't figure in our pandemic response to any particular extent. I included here just a quick snapshot of the recent data from Manitoba on the levels of social assistance support available. And you see here for the different categories of folks like single people who are considered employed or person with disability, you see on the bottom, actually, the benefits that they are eligible for are a fraction or less in the case of single employable person, about half of what Canada's official poverty line is. That's the market basket measure. These are data for Winnipeg. So roughly, so these people are currently and continue to exist on very, very low incomes, and they received marginal support. BC actually was the only province that actually increased benefits to social assistance and folks on disabilities in particular, and they've just recently made that permanent. After much pressure, that was a fight. Another group, of course, that was poorly served in our response were certainly, and we continue to see this fight play out, workers who continue to work in the low-wage sector and front-facing industries and light manufacturing, they were poorly served by Canada's recovery sickness benefit, which actually has failed to reach many. And, against a context of, Canada's inadequate patchwork of employment standards, and in particular, access to employer-paid sick days. This, again, is a quick chart of the availability. Again, that varied across the provinces. Employment standard, obviously provincial responsibility for the large majority of workers in Canada, but certainly our disjointed provincial job protection laws fell miserably short and continued. So we saw, certainly in Ontario, where I live, we saw really high rates of illness and death among workers in the GTA, the Brampton area, very concentrated, had everything to do with working conditions and availability of sick leave. So massively failed, our response massively failed this group of workers. Wanted to segue now to talking about what also was highly problematic in our pandemic response, continues to be problematic. And that is, of course, our response to care and our response. When the pandemic hit, of course, as I said, it blew open our social safety net. We saw the huge gaps in our income security, but also the huge gaps in care. Obviously, the situation in long-term care homes was the most graphic and deadly. As upwards of 30,000 people died, and a large majority I think it's 56% at this last count, were vulnerable seniors in care. But the state of our services, caring services going into the pandemic, was very vulnerable, large chunks of which rely on market income or competitive tender, were hugely exposed and collapsed under the pressure. I also think the huge and deep gender biases that assumed, certainly in the response and lack of response that was forthcoming to support community service, to support caring services, reflected a profoundly deep gender bias that women effectively would just step in and get on with it. That, again, they would be the shock absorbers, that they would be there to pick up the slack. This isn't to say that I don't think Canada's nonprofit and community sector stepped up massively to provide hours of care, to support people in long-term care homes, to support the unemployed, to support newcomer communities. But these essential workers often did not have the tools, the resources to keep everyone safe, to do the jobs that they needed to do. And I think that was a huge problem in Manitoba. Again, I defer to your expertise, where Manitoba went into, and as I know from research of my colleagues in the Manitoba office, they went into the pandemic with experiencing reductions. I guess the government had announced an austerity program prior to the pandemic, which played out in the early months with devastating impact, where I was looking at the experience of women in these bars here, look at Manitoba and Canada. And this is among female workers by industrial sector. And we see here for health and social services that there was a 14% loss of employment over that 2-month period from February to April. Certainly among women, there was a significant loss of employment. So effectively tying your hands behind your back in the context of the pandemic. The largest losses, of course, were information and culture and recreation and food and accommodation. It's interesting looking back to see the recovery where Manitoba women are today by industrial sector And we still see, here's healthcare, that they're still 4 points off of where they were in February 2020. Retail trade is certainly still down. And interestingly, in Manitoba, employment in professional and scientific and technical services, which has increased quite significantly nationally, not so among women in Manitoba. That was one of the other interesting things. But my global point, going back, is that the response to care and the vulnerability of care services was exacerbated by austerity at the beginning of the pandemic in selected provinces such as Manitoba. Sorry. I wanted to look a little bit what happened in as an example of a care sector. I wanted to look at childcare because that was really, and we have really great new information sort of coming forward and documenting how that's impacted women in particular, and the differential responses of governments to the crisis in care. So that, as I said, the system itself was fairly vulnerable going in. A large part of childcare in Canada is market driven. It's obviously centers and home daycares rely largely on parent fees. I know that's different in Manitoba. You've got a large set fee portion of the childcare system. In provinces like Ontario, however, largely market driven. And of course, as the public directives came on, thousands and thousands of centers closed. Even as they eased these centers, the financial model buckled. They struggled to gear up capacity again in the face of declining enrollments, staffing shortages, rising costs related to providing health, safe, PPE and the like. So the financial precarity of the childcare sector, certainly at the height of the pandemic through last year, was marked. And, even now, significant capacity losses across the country still undermining women's economic recovery. This chart looks at in the face of that. So what did governments do? And of course, it was quite varied. This looks at 4 provinces here. It varied, for instance, in a place like Alberta. So in the face of that catastrophic drop in women's employment, catastrophic loss of childcare capacity, the Alberta government actually did not provide any normal government funding. In 56, it's the yellow bar, 0.5% of cases, those centers actually received no normal government funding. Whereas Prince Edward Island, if you look at the blue bar, of course, they had a much more, they were in the bubble, they had a much more modest pandemic impact of illness. But they provided, not only did they provide normal funding to all of their childcare centers, they actually provided additional monies through federal government transfers to provide additional safety measures to pay for PPE and the like. So there was really quite, you look in Canada, there was, as I said, hit and miss, a really diverse response. That would have played out in different sectors. I haven't studied the community health sector. I much suspect you would have seen similar pattern where there was different responses, and all of which together created a massive insecurity. So you have in some provinces where you see a huge increase, as we saw, of women leaving the labor market, mothers at a rate of 10 times that of fathers to take care of care response because of the collapse of care, services in the care economy. It was really critical, and re-ups the importance of why we have to look at childcare and what this moment means in terms of creating a universal system to help pandemic proof, to help actually create a solid foundation of caring services in Canada to offset and to support families. I think that's a starting point, certainly from where we need to go next. Conscious of time, and I just want to outline a few things going forward and get into questions. I like this particular quote from Angela Merkel last year, where she said the virus punishes the half-heartedness, and I think that's certainly true in Canada. I very quickly would like to say, we in Ottawa, we have a new set of, had the election, we have a new set of ministers, we've got a new Minister of Women and Gender Equality. They've got mandate letters coming down the pipe that with the opening of Parliament later this month, I guess in a week or so. I think there should be a number of things on their mandate, on their to-do list. The first being a firm mandate for care that looks at completing national plans for childcare, as well as seniors and people with disabilities across the life course. That includes a national labor force strategies in key sectors like healthcare that look at education and training, certification, recruitment, and retention has to be involve increased wages for low-paid healthcare workers, absolutely fundamental, low-paid care workers. This will require boosting of federal transfers that are tied to negotiated agreements, such as going through this process with childcare right now, and public reporting on progress on mutually on common metrics. This has to be much more transparency. We have to be making investments, tracking those investments, and seeing that those who are most impacted, marginalized women, Indigenous communities, that they're at the front of the line getting the resources they need. We need absolutely to move quickly and with dispatch on the implementing the calls to justice from the National Inquiry on Murdered and Missing Indigenous Women, and need to move forward with aggressively with a comprehensive national action plan against gender-based violence. Federal government has put up money for this. We have yet to see the plan. There's no secretariat, there's no coordinate. There are many moving pieces, and we need to see progress very quickly on that. There's a long list of things. I was speaking about our income security programs that we need to tackle. EI is at the top of the list. That would include benefits to support women and others taking on caregiving. That's one of the big lessons from the pandemic. We need to move very quickly, much more quickly than so, to create a Canada disability benefit. We have many ideas at this Canadian Centre for Policy Alternatives that we've included in our new alternative federal budget, which we just released, and I'm happy to share that with folks who are interested. And the other piece, which people haven't really been talking about, certainly is training and skills building, and in reinvestment in modernizing employment standards. So coming back to that 10 paid sick days, it's fundamental to create security for workers. These are the conditions we need for care. We know working conditions are conditions of care. We know that all work must be decent work. And this is a hugely important lesson coming from the pandemic to ensure health and well-being and an inclusive recovery for all. I'm going to put up my, oopsie, there we are, my contact information. I'm happy to chat with anyone. I'll stop sharing my screen, and Tiffany said she's going to fire some questions to me, and we can hopefully get a bit of an exchange going. Oh, okay. What kind of jobs were women? Okay. Women, that's it. One of the things is sort of a labor economist, my gender equality is one of my files. And one of the things that has moved more slowly, glacially, there's many things that move quickly. The changing occupational segregation of women is not one of them. Women effectively are concentrated in the same types of professions they were 50 years ago. That despite some significant efforts to mobilize women in the STEM fields, science and technology, engineering and the like. Women remain largely concentrated in service industries. That includes health and education, like upwards of 3/4. For instance, in Manitoba, 3/4 of workers in the health and social assistance field are women. Women are a disproportionate share of retail sector workers. They're a disproportionate share of education workers, across all educational workers, like teachers, as well as educational support workers and admin and like. Obviously, a dominant share of increasing share of professional services. So those are the types of jobs. And that's that was so distinctive about this recession. In prior recessions, we can go back to the early 80s, 90s, and even around 2008, 2009. Men lost jobs at it was sort of like every one job a woman lost, it was 4 jobs that men lost. These were export-driven recessions where you saw a collapse in manufacturing in male-dominated, male-majority sectors. This was totally upended and on its head, that women experienced the largest losses and have, as a result, experienced the slowest returns. For me, the question is what's next? We've just lopped the bottom of the labor market off, and that's huge. Is food and accommodation coming back to those numbers? What kinds of transformations are taking place? And I think that's part of the moment. We're not sure. And that will have huge consequences, certainly for women going forward and other marginalized workers. Okay, looking at the questions that Tiffany is kindly putting up. Have you looked at the rates of infection among female workers? No, it's hard to get data about what workers have been affected to start with, and that women may be in jobs not covered by workers' comp. The fact it's hard to find out is telling too. Huge data gaps. It's interesting. We get these, like that whole idea around mass resignation. That was a story from the US. The US has fantastic data. Canada, not so much. We have made some progress. For instance, StatsCan is now collecting racialized data. We didn't do that on a labor force survey by, unpacking a category which they have historically called visible minority, but we now have much better data. But there's still massive holes. People with disabilities, massive holes. You might get information once every 5 years. As to your question on infection rates among workers, again, that data has not been, as I understand it, is not readily available. Certainly some of that data are available in provincial labor departments, the folks that run workers' comp, or who would presumably be receiving those requests. But certainly in Ontario, that data have not been released. We know certainly from the work of some public health agencies and we're starting to track that, certainly in terms of the closures and, as pertains to that, but we don't have systematically, we do know, for instance, that certain jobs, of course, are much more likely to bear reported levels of illness because of their characteristics, whether they were in light manufacturing, in tight congregate settings, the meat plant and the agricultural and food sector, particularly like you saw the massive closures or the deaths and closures in the large scale meat facilities in Alberta. We know that, but there's no good comparative data at this point. Final report on the murdered and missing Indigenous women, National Inquiry into Murdered and Missing Indigenous Women and Girls, recommends a guaranteed basic income to address poverty. Would this be helpful in your perspective? There's nothing more. 100%, yes, I completely, the failures of the income security system were graphic during the pandemic. I thought it was, from women's perspective, it was interesting that the CERB, which was quickly available, was available to women workers who experienced employment loss. It was not subject to a family income test, so it was based on your work experience. It was a flat benefit. It included folks who made up to $1,000 a week in earnings, no, $1,000 a month in earnings, which included a large number of low-wage women who would never have qualified for EI. It was critically important to low-wage women, this program, and you saw the impact that money had. And now, of course, so many are now, have nothing. CRB has just shut down for the self-employed. EI continues. Many people will be out of their EI benefit period, certainly coming to the fall. So tremendous uncertainty going forward. A basic income, I think the CERB experience, I don't think the CERB model, but the CERB experience illustrated the massive holes and the need for programs that create stability, that provide stable income. I think the debate is around what's the best way to do that. So in our federal budget, our alternative federal budget, we have several income security policy proposals, including one that targets working age people without kids who, there's nothing outside of social assistance for them. The Canada Workers Benefit certainly doesn't meet the needs as it's currently structured of this group. And people with disabilities, huge levels of poverty because they're forced to rely on social assistance, which provides just marginal benefits, fearful to leave or engage in work because, of course, of the loss of community benefits. So we put forward a proposal for the Canada Disability Benefit that would see the disability tax credit converted into a refundable credit as in year one. And then we would move to expand eligibility to people on social assistance, people with disabilities on social assistance. And the money that provinces would save that would then be reinvested in services to support the inclusion of people with disabilities, the berries, attendant care, all of these things that are fundamental to enabling people with disabilities to live with dignity and healthy, dignified lives in the community. So I don't think there's I think we need to complete our social safety net. I think we need to we've got kids benefits, we've got seniors benefits, we have EI, we need to reform EI and bring in new pillars to complete so that everyone has access to a guaranteed livable income, as opposed to one basic income program. What could some solutions that can be taken to different areas of government to help women in vulnerable sectors? I think childcare is, when we think of the pieces that are needed and, the disproportionate impact on women or immigrant women and so forth, I think their investments in the care economy are fundamental. And in that sense, the proposal to create universal childcare is hugely important. It's not done yet. There's a big price tag on the table. We have bilateral agreements, some of which seem to be better than others. We also, federal government before this flowed money to the provinces for childcare. But the issue, the question now is whether these new investments will actually be transformational. Will they create a universal system that has $10 a day childcare that's affordable, including supports for people who actually can't afford $10 a day? That's in a publicly planned system where you actually have childcare going in as the essential service that it is, not just the happenstance of a particular owner that opens up, a family home care on your street just because. We need a system that's universal, and I think that will be really fundamental as a plank that facilitates women's economic security, women's engagement, labor market, their caregiving. There are other steps, I think, that are really important as well. I think we have to revisit, certainly for groups of migrant care workers, we have to revisit the programs, the immigration programs and migrant care programs, and ensure pathways to permanent residency and to strengthen labor market protections for women working in those settings. I think we need to look at training. There will be a lot of women who stepped out of and this is true before, a lot of women who step out of the labor market for a period of time. They make that cost benefit analysis, pay a huge price in terms of lower lifetime earnings, potential poverty in their old senior years. We have to look at what's needed to facilitate people's transition back into work. This is true for all those folks who are now long-term unemployed, unemployed for more than a year. And Canada's not been great. Canada is a laggard on training globally. Certainly we're a laggard in terms of employer sponsored training. We're at the bottom of the OECD league table. So I really think we need to think about that. We've had a system where folks, if they get EI, can access a particular group, training programs, and everybody else is sort of, has access to some sort of light touch programming, which isn't going to cut it. I think we really need tailored programming, wraparound supports, the kinds of things, working with community health centers, for instance, like building out the supports around people to facilitate their economic security, to identify what's needed to support women fleeing violence. It's another great example, like what kinds of support are necessary to wrap around training, education, and the like, so that they can stand on their, can participate and facilitate their economic security, facilitate paid employment and the like. So those are two things I think that are really important. What could be some other solutions to help Indigenous and racialized women in the labor market to earn a stable income? Okay, just looking time. That also is a great question. I think what I was talking about in training and sort of that was a good piece of that. The way I kind of think about it in crafting, we've been involved with other folks and at the CCPA creating what would be the planks in a feminist intersectional recovery to produce a gender just recovery. I think about the foundation. So we need those things like income security. We need affordable housing. We need, access, assured access to education and support for children. We need investments in childcare. I think those is sort of foundation, we need a really strong foundation of those public services. They have to be public. done with privatization and austerity. Let's be clear, essential services, all monies need to be directed to creating a foundation of public services. And when you have that, then you are in a position then to create programs that target the unique needs of particular groups. For Indigenous women, that is in particular in the massive gaps, education, employment, earnings, health and well-being, obviously well-documented gaps in health and well-being. I think the solutions must be led by the Indigenous community that recognizes the unique standing of Indigenous communities and nations in the delivery and in the determination. So we create a foundation and then we go hard on tailored responses to different particular groups. That's like for newcomers, different set of immigrant settlement agencies. I think that's a really big part of creating a comprehensive response that would, facilitate greater security so we can start to close those gaps. I'm not sure that's as detailed. I'm happy to follow up afterwards, but I do think it's that combination of creating a strong, inclusive foundation and going hard on tailored responses in areas that need it. Like for childcare, for instance, there's all sorts of areas we can talk about. I see a question, Tiffany, zipping these up really quickly. What do you think about paid sick days for those in the low wage sector? This seems necessary. 100%. We should be thinking, I think it's important. I mean, and you're in the health sector, that this is, there will be other pandemics. We're actually not out of this pandemic. We need to be thinking about in a way that we were reluctant after the SARS, which makes our travesty and unpreparedness even more egregious, because we actually had a taste of what the COVID-19 was going to be. We need to be looking at what are the things that need, how do we pandemic proof our income security systems? And that's why I was talking about employment standards, paid sick day. The fight against employer paid sick leave, which actually is not the most costly item is really problematic and troubling in a really in my own province of Ontario. I mean, our government was forced kicking and screaming into introducing a pretty namby-pamby, not a particularly great model of 3 paid sick days, which still is having particularly low take up because of its structure, forcing low wage workers to apply. Again, only available if you've been ill for a certain amount of time, so you don't get that time off to go, take care, go to a doctor, get tested or anything. We know how to do that for people, who have employer leave paid sick days. They just take the sick days. We know how to do that. It's been just really a difficult challenge to sort of break the logjam on moving that forward, but it will be critical to support and protect low wage workers in particular. It's part of the foundation. The other piece I think of that is looking at the whole debacle around gig work and whatnot, and this idea misclassifying workers. We really need to go hard on improving employment standards so that those workers have access to basic employment rights and benefits. I mean, it's really imperative. I'm hoping federal government's looking at this, and they only have 10% of the labor force, but I'm hoping we can get some good, let's hope they'll bring in good reforms. We need to model that, and we've got to knock the provinces off one by one. We've got to push up the floor, include some minimum wage, a variety of things. We have to go hard on creating a better floor for low wage workers. I've got a question here. Do you think you can address this? How do we stop spreading the myths about COVID-19 vaccine and call out the spreaders to share their facts? It does play a part in the employment of women in the service sector. I'm not, I'm not sure. I'm looking, if I could speak to that, I fundamentally agree. I say that as someone with many relatives in the health sector, and am gutted by what's been going on of late. I am not sure how we do better. I know public health is certainly on that, or how we address this question. That's not my area of expertise, but you're right. It has had a profound impact on people's economic security. It continues to have a profound influence on the rollout of the recovery and imperiling the health and well-being, particularly of women in the low-wage service sector who face great heightened risk and danger attached to that work, precisely because we failed to provide a comprehensive, we failed to take measures that would create safety for all. I'm not sure what else to say about how best to counter those myths or get to that. I think the public health folks are grappling with this, and it reflects on the divisiveness and the way we fractured in the pandemic. Some of us saw this coming together, and there has been extraordinary efforts of collective mobilization and mutual aid, like really extraordinary, but in many ways clearly has driven wedges between people who are on different political divide, who grasp onto this issue, and it's hugely problematic. But I'm not sure about the actual vehicles for hopefully moving folks onto the same page. The last question here, I see, hang on, is the last question. Yep. For paid sick time, who would be responsible to foot the bill for that? The employers, the provincial or federal? Well, there are different models. In Ontario, for instance, the government, their jerry-rigged program is effectively 3 paid sick days where employers pay, you qualify for these, and then the employer pays it, but is reimbursed by the provincial government. There's some, again, it's been low, the structure of it is such, there's been low take up. Certainly the gold standard is employer paid, because it's part of the employment contract. It's quite straightforward. You're sick, you have so many days that are allotted. There's no stress, there's no mush, you don't apply for anything. You are eligible for these days as a right of employment. That is the way to do it. That's the easiest way to do it. There can be other financing arrangements in the background around that. Different models. I know certainly the labor movement is pushing hard on the 10 sick days an employer, and to do that stuff. It is a cost. Certainly employers are facing a variety of costs right now. I just saw, obviously, whether it's rising payroll, taxes, certainly pressure in tight industries, rising wages. In Ontario, it's just raised the minimum wage, which, I would say the Ford government, of course, froze 3 years ago. But important, again, setting the floor. But obviously it becomes challenging for low wage employers. I guess I take a bit of the view that if you can't do business, if your margins are so tight, you have to exploit your workers. I think you need to rethink your business model. I take that. And we do also have great evidence, though, that, by pushing up the floor or creating a floor, a living wage floor, that in fact, it benefits everyone. Like there is no precipitous employment loss, that, many more workers have income. Those workers in households with greater incomes are spending those money in local communities, fueling economic activity. So I know it can be certainly challenging for individual businesses, but we have to, we can't move forward with economic models that run on the backs of workers and who face tremendous illness, who face great stress in their in daily lives. So I think I agree. Paid sick leave is one of the issues. I think that could and should make a huge difference in people's lives and for our collective security. It's an investment not just in the individual work. It's really investment in all our health and well-being.
Thank you so much, Katherine, to giving us a really, really great informative session. I saw all the comments on the chat. They all love it and then enjoy what you put about your recommendations, everything. The report was really, really great. If the audience here haven't have a chance to review the report, I could send the link to the report the CCPA has been created about women's work and the COVID, how to support women. So in this really difficult time. So thanks again for all your time to present for us. And thank you all of you to joining this presentation. The slide will be shared to you once this is available with the record session and also the report as well. So hope everyone have a great day and enjoy the great afternoon and stay safe. Bye, everyone.
Thanks so much.
Thank you.